Welcome to NA's Quick Anatomy. This is the upper limb module on the axillary artery. How to navigate through the lecture. The video will run continuously. To stop it, click pause. To continue, click play. If a question is asked of you, number 1, click pause to think about the answer. 2, then click play to show the answer and pause immediately to reflect on the answer. 3, then click play to continue the video. You can also use the scroller to move the video forward or backward. You can click on More to see the timing of the various video segments. Click pause to read this page. Click pause to read this page. Click pause to read this page. Let's now study the axillary artery. A. What is the importance of the axillary artery? The axillary artery is practically the sole blood supply of the upper limb. If this blood supply becomes inadequate, the upper limb may undergo necrosis and require amputation. This outcome could be due to a blockage by a blood clot, 2, penetrating injury like a knife stab or a sharp edge of a nearby fractured bone, 3, kinking due to a shoulder dislocation or the presence of a cervical rib, that is, an extra rib located above the first rib. The muscular landscape related to the axillary artery. If you are familiar with the muscular landscape, you'll find it easier to follow the cause, relations, and branches of the axillary artery. The muscular landscape of the anterior chest. Let's outline the deltoid in red and remove the muscle. Let's outline the pectoralis major in purple and remove the muscle. Let's remove the outline of the deltoid. Let's remove the outline of the pectoralis major. Let's outline the pectoralis minor in yellow and remove a part of it. Let's add the axillary artery. Take note of these 4 muscles: the subscapularis, the teres major, the latissimus dorsi, and the long head of the triceps. The intermuscular spaces. We covered this in the lecture on the axilla. These are 3 important intermuscular spaces commonly referred to as gateways. 1, the quadrangular space. 2, the triangular space or upper triangular space. 3, the triangular interval or the lower triangular space. Let's go to the dorsal view. 1, spine of the scapula. Spine means backbone. So this is the backbone of the scapula. 2, supraspinous fossa. Supra means above and spinous refers to the spine. 3, infraspinous fossa. Infra means below. 4, acromial process. Let's remove it. Superior, middle, and inferior facets of the greater tubercle. The infraglenoid tubercle. We will study the muscle from the superficial to the deep. 1, the trapezius muscle. Let's outline the muscle in green and remove the muscle. The deltoid muscle. Let's outline the muscle in brown and remove the muscle. The muscles that are relevant at this stage are the supraspinatus, the infraspinatus, the teres minor, the teres major, and the long head of the triceps. Let's remove the pictures of the muscles and observe their origins and insertions. The infraspinatus, the teres minor, the teres major. Take note of the 3 intermuscular spaces seen in the dorsal region of the scapula. 1, the quadrangular space. 2, the triangular space. 3, the triangular interval. C, general principles related to the arteries. Understanding the general principles of arteries is essential. Firstly, I do not want you to simply memorize information from your textbook about the cause, relations, and branches of an artery or what it supplies. Instead, carefully observe the diagrams I have painstakingly selected for you and describe what you see. Anatomy is a visual subject, and my motto for learning anatomy is, if you can see it, you will remember it. Secondly, the structures supplied by the arteries are not highly specific. In general, arteries supply structures in the vicinity along their course and at their termination. These structures may include nerves, bones, joints, muscles, lymph nodes, connective tissue, and fat. Thirdly, arteries typically supply the skin and subcutaneous tissue that lies superficial to them. The axillary artery. Let's remove the outline of the pectoralis major. Let's now remove the clavicle and the subclavius muscle. Let's remove the outline of the deltoid. Let's insert the axillary artery. Let's remove the latissimus dorsi. This is the tendon of the teres major. This is the first rib. The axillary artery begins at the lateral border of the first rib. The axillary artery ends at the lower border of the tendon of the teres major. Take note of the following structures: the scalenus medius, the scalenus anterior, the subclavian artery, the brachial artery. Note that the axillary artery is divided into three parts by the pectoralis minor. The first part is proximal to the pectoralis minor. The second part is posterior to the pectoralis minor. And the third part is distal to the pectoralis minor. A, the relations of the axillary artery. Many anatomists describe the relations of each of the three parts of the axillary artery separately. I choose not to do so because it is unnecessarily burdensome for the students and is not necessary. By learning about the relations of the whole axillary artery, you will be able to work out the relations of each part. 1. The anterior relations of the axillary artery. They are as follows. 1. The subclavius. 2. The pectoralis minor. 3. The clavipectoral fascia. It lies anterior to almost the whole length of the axillary artery. 4. The pectoralis major. Let's insert the outline of this huge muscle. It lies anterior to almost the whole length of the axillary artery. Let's insert the picture of the muscle. Note, the last part of the axillary artery is covered only by the axillary fascia, the subcutaneous tissue, and skin. Why is this important to know? Its easy accessibility makes it 1. Easy for checking the pulse. 2. Easy to compress against the humerus to control bleeding. 3. Vulnerable to penetrating injuries. 4. A useful site for performing surgical procedures like arterial cannulation, bypass surgeries, and aneurysm repair of the axillary artery. 2. The posterior relations of the axillary artery. To see this clearly, we need to remove structures anterior to the posterior wall. 1. The picture and outline of the pectoralis major. 2. The clavipectoral fascia. 3. The pectoralis minor muscle. 4. The clavicle and the subclavius muscle. 5. The scalenus anterior muscle. 6, the subclavian artery. 7, the labels for the parts of the axillary artery. The posterior relations are as follows. 1, the upper part of the serratus anterior. Let's shift the thorax to the right to fully expose the other posterior structures, which include the subscapularis, the latissimus dorsi, the teres major. The medial relations. Let's move the thorax back into its original position. Most anatomists state that the axillary vein lies mainly anteromedial to the artery, rather than strictly medial. However, its terminal part may be situated anterior to it. The relations of the brachial plexus. The axillary artery and its branches have very important relations to the different parts of the brachial plexus. We will discuss the relationship between the axillary artery and the brachial plexus when we study the brachial plexus in the next lecture. The branches of the axillary artery. All three parts of the axillary artery gives rise to branches. The first part gives off 1, the second part 2, the third part 3 branches. The branch from the first part, the superior thoracic artery. It passes anteriorly and medially to supply the upper anterior part of the thoracic wall and the supromedial part of the pectoralis major muscle. Let's remove the superior thoracic artery. The 2 branches from the second part. 1, the thoracoacromial artery. 2, the lateral thoracic artery. The thoracoacromial artery. 1, it arises from the second part of the axillary artery behind the upper border of the pectoralis minor. Let's insert the clavipectoral fascia. It passes forward and pierces the clavipectoral fascia. It immediately radiates into 4 branches, which are named according to their destination. 4. In a clockwise direction, these branches are the deltoid, acromial, clavicular, and the pectoral. Let's study these branches one by one. A, the deltoid branch. It passes laterally between the clavicular head of the pectoralis major and the pectoralis minor, both of which it supplies. It then runs along the deltopectoral groove. It finally crosses deep to the anterior border of the deltoid and supplies it. B, the acromial branch. It passes upwards and laterally over the coracoid process and under the lateral part of the clavicle to reach the acromion, which it supplies. It also gives branches to the deltoid muscle and the acromioclavicular joint. C, the clavicular branch. It passes upwards and medially towards the clavicle, between the clavicular head of the pectoralis major and the clavipectoral fascia. It supplies the clavicular head of the pectoralis major, the subclavius muscle, and the sternoclavicular joint. Although it is called the clavicular branch, it does not supply the clavicle. D, the pectoral branch. It passes downwards and anteriorly between the pectoralis minor and the pectoralis major and supplies both of them. In females, it gives off perforating branches to supply the breast. We have just studied this. Let's now study the lateral thoracic artery. A, it arises posterior to the lateral border of the pectoralis minor. It passes downwards and forwards and pierces the clavipectoral fascia. It then runs along the lateral border of the pectoralis minor and divides into many branches. It supplies the pectoralis minor, the pectoralis major, and in the female, it gives off lateral mammary branches. Branches of the third part of the axillary artery. Number 1, the subscapular artery. Number 2, the anterior circumflex humeral artery. Number 3, the posterior circumflex humeral artery. Let's study the subscapular artery. Let's move the thorax to the right to get a better view of this artery. The subscapular artery. The main trunk arises from the third part of the axillary artery at the inferior border of the subscapularis muscle. It passes along the lateral border of the subscapularis. After a short distance, it divides into two terminal branches: the thoracodorsal artery and the circumflex scapular artery. Let's study the thoracodorsal artery. The thoracodorsal artery. The thoracodorsal artery passes towards the inferior angle of the scapula, where it gives branches to the muscles in that area: subscapularis, serratus anterior, teres major, and the latissimus dorsi. This is the inferior angle of the scapula. B, the circumflex scapular artery. 1, it winds around the lower border of the subscapularis and leaves the axilla by passing through the triangular space. Let's go to the dorsal scapular region. Let's insert the circumflex scapular artery. It enters the posterior scapular area by passing through the triangular space. It enters the infraspinous fossa by passing deep or through the teres minor. Structures supplied. It mainly supplies the lateral half of the infraspinatus. Other muscles that it supplies along the way include the subscapularis, the teres major, the teres minor, and the long head of the triceps. As it winds around the lateral border of the scapula, it often causes a groove. We've just done the subscapular artery. Let's now study the anterior circumflex humeral artery. It arises from the third part of the axillary artery immediately after the origin of the subscapular artery. It then passes laterally and winds around the anterior aspect of the surgical neck of the humerus. It ends by anastomosing with the posterior circumflex humeral artery. It gives off the ascending branch, which passes upwards along the intertubercular sulcus and supplies the shoulder joint and the head of the humerus. The anterior circumflex artery supplies the anterior and lateral fibers of the deltoid muscle. We have just finished the anterior circumflex humeral artery. Now let's study the posterior circumflex humeral artery. It arises from the third part of the axillary artery immediately after the origin of the anterior circumflex humeral artery. It exits the axilla by passing through the quadrangular space. Let's follow it into the posterior shoulder region. It passes into the dorsal scapular region by traversing the quadrangular space. It then winds laterally around the posterior aspect of the neck of the humerus. It then anastomoses with the end of the anterior circumflex humeral artery, forming an arterial circle around the surgical neck of the humerus. It supplies the posterior and lateral fibers of the deltoid. Branches. It gives off the ascending or acromial branch, which supplies the acromion, the shoulder joint, and the muscles around the shoulder. It also gives a descending branch, which supplies the upper part of the arm. This branch anastomoses with an ascending branch from the profunda brachii artery. Clinical relevance. The anterior and posterior circumflex humeral artery form a closed arterial circle around the surgical neck of the humerus. Fracture of the surgical neck of the humerus may sever this arterial circle. To complete the picture of the posterior shoulder region, let's insert the outline of the deltoid muscle. Congratulations, you have completed the study of the axillary artery. Please take the evaluation to assess your understanding of the axillary artery. How to navigate through the questions. When a question is presented to you, number 1, click pause and answer it. Number 2, click play for the answer and then immediately pause again to compare your answers. 3, click play again to go to the next question. Click pause to read through this. This lecture is for medical education and is non-profit. This is the end of the lecture on the axillary artery. See you in the next lecture.